Hello everyone, this is Shad Reis from CVI 2023. I'm very privileged to be with Dr. Mauricio Cohen, who's coming from Cleveland Clinic. And today we're going to talk about bifurcation. Dr. Cohen, thanks for being with us.
Oh, thank you so much, Adi, for inviting me. So yeah, this is an amazing meeting, by the way. CVI, we're always here for a treat when we come to this meeting. So many cases and clinicians and friends. So this year they asked me to present a case of a bifurcation left main, which is always a challenge. And there's been an evolution in different techniques for bifurcations, and I think the operator has to be able to identify which is the right technique to use in each particular case. That means individualize the care for the patients. In my case, I presented a lady that was not a surgical candidate with an acute coronary syndrome, and she had a severe left main disease. So, you know, I enjoyed bifurcation, distal bifurcation left main. So I was able to merge my two passions, which is complex interventions and radial access. So in this case, we did it through the patient had PVD, not eligible for support, and we did it through a snap box approach in the left side. So with the 6 French, and this is all you need really. Unless you are doing kissing stents, I think 6 French is all you need to do a left main bifurcation. I think that many people would like to have other options and choose to go with the 7 French. There's nothing wrong with that. But I think in our case, we were limited with access. Yeah. So in that particular case that I presented, I think that the DK crash technique is it's a very nice technique, and I think according to the data that's been published out there,
the most,
it's
durable.
Yeah, it seems to be the most durable. Yes, but it's complex. It involves many steps. So there's a nice app called the Bifurcate. So I had a tech in the cath lab using the Bifurcate app, and then telling me, so do this next. Okay, what's the next step? And then we would keep doing the same, all the steps, just to follow the technique to the
optimization.
Yeah.
So this is usually your standard of care for all, like Medina 111 to
exactly. Yeah. But for Medina 111, especially in the left main, we always think the Achilles heel is the restenosis of the ostium of the circumflex. So I think in that way we can optimize the outcome. But you know, there's always the axiom in interventional cardiology: keep it simple, keep it short. So if you can stent across the side branch and do provisional, I think that's the best strategy. And if you can get away with that, I think that's the best outcome for the patient, and you make things less complex. And I think the complex interaction between the tissue and the metal and several layers of stents can make the antithrombotic therapy is a little bit more challenging.
Absolutely. You mentioned offline about an upcoming ebook for bifurcation.
Correct. So about a year ago, I finished my tenure as the director of the Ischemic Heart Disease Council at SCAI, and one of the projects that we came up with as a group was to put together a bifurcation ebook. So with the leadership of Kate Kearney and Arasi Maran and myself, we are moving along. All the chapters, most of the chapters are in. It's a truly international book, so it will be very practical. It'll be one of those that you plug into the computer, and the pictures come in and the text comes in. And we're hoping for great graphics and animations and tutorials on how to select the right patient, understands the advantages, disadvantages of each one of the techniques, and all written by world experts.
Yeah, I think this is one of the trends for SCAI. They did the Access book before. Yeah. And it's continuously
And there's
updated.
a microclip book. I think it's a theme for SCAI, and I think it provides, in a little small card, provides an amazing source of information.
And it's illustrated, basically on illustrations.
Yes.
Which just walk you through the steps you just mentioned.
Exactly, and animations.
Animations
on how to proceed with different steps.
Well, thanks for helping us with that, because bifurcation always doesn't come too often, but when it comes, you have to revise all your knowledge for the case, so that will become handy.
Optimize and individualize the care.
Absolutely. Thank you, Dr. Cohen, for your time.
Thank you so much.
Please watch these videos and others on CVI YouTube channel. This is Shadi Reyes from Austin. Thank you so much.